Chiropractic care and spinal stenosis. People can be very concerned about chiropractic care. It could be aggressive, it could be forceful, it could be bending, it could be twisting. I don't want that. Well, guess what? Did you know that there's an alternative technique with drop pieces that can be used that can help you with your spinal stenosis that is extremely gentle? Watch this video, because today I'm going to show that to you. I'm going to demonstrate that to you, and I'm going to explain to you why this is going to help with your spinal stenosis. My name is Dr. Shariff. I'm a local chiropractor in Oshawa, Ontario. My clinic name is Infinite Healing Chiropractic and Wellness Center. And our mission on this channel is simple. It is to help teach you how to optimize your health, how to live life to the fullest, how to live life without invasive procedures or surgeries or pills to start maximizing the inner potential you have. So watch this video in its entirety. If you're interested in learning more about your health and how you can maximize your potential, then subscribe to this channel, like this video. You will be informed of when I actually post out new videos. This is all about you and about living your life. So if you're interested in maximizing your potential, watch this video in its entirety. Let's start. So what is a drop table? It's a specific table that has drop pieces ergonomically designed in there. And in the tables that I have, they are air drops. So that makes it very gentle. So I'm not bending a patient, I'm not twisting a patient, I don't need to. Now some patients with spinal stenosis can maybe tolerate this, but some patients can't. So you have to have a different type of technique. And I have the drop piece technique. So those drop pieces are based on gravity, on timing. It helps to reduce the amount of force that a chiropractor has to use, which makes that adjustment extremely gentle for that patient. So why do we use the drop piece for this patient and stuff that has spinal stenosis? Why do we have a patient that sometimes comes in and says, hey, you know what, I saw a chiropractor, but it made my symptoms worse? This is why. Well, sometimes when you're so inflamed, the muscles are tight, the inflammation is high, the spine is in guarding mode, the muscles are in guarding mode, the nervous system is what we call in a sympathetic mode. That means it's in a fight or flight response. Everything is heightened. Getting in there and doing a forceful technique could actually aggravate the symptom, could actually make it worse. So it's important to understand what type of position and situation the patient is in, and the drop piece technique is great, because it is gentle. The patient just lays. There is no twisting. There is no aggressiveness in there. And it makes it an easier adjustment for the body to handle, which reduces the tension off the nerves, which reduces that muscle guarding, and the patient starts to feel better. So now it's important to understand, how do we do that? How do we adjust a patient with spinal stenosis? What do we do with that drop piece? Come with me now. I'm going to show you the drop piece technique. So what you're going to witness here is the drop piece adjustment. This is a great adjustment to use. It's extremely gentle. It works for a lot of patients. The patients that don't even like the manual adjustment, going onto their side, getting adjusted, they prefer this type of adjustment. The drop pieces in the table absorb all the impact of the adjustment, so it's extremely gentle. All the patient has to do is just lay in this space the way they are. So first thing we're going to look at is we're going to look at the leg lengths. So we're going to see if the leg lengths are off or not. And so when I'm looking at this, we can see how one leg is shorter than the other. When you look at that, you're looking at the bottom of the heels, okay? Actually, what you're looking at is this space right here, okay? That's the space that doesn't erode when a person's walking on their shoes. And you'll see how this side is actually shorter than this side, okay? Now the next step is we want to now move into a flex position with the knees, and we want to see, does that short leg stay short, stay even, or become longer? And you can see from this that it becomes longer, okay? So this immediately tells me from this presentation that we have a pelvis misalignment, and the pelvis misalignment is on this side, and that's the side I'm going to be adjusting. Now, you'll see I crossed one leg over the other, and the reason why I crossed it over the other is it helps to gap the joint. It makes that adjustment a lot easier. And then I place my hands on here, and then I'll adjust through. And that is your pelvis adjustment. Now the next step is, let's check the leg lengths and see if they've changed. So now let's check these leg lengths and see how they've changed after the adjustment. You can see how they become level now, okay? So that means we have adjusted that pelvis. We want to double check with bringing the knees up. And again, See how it's a lot better, okay? That is a change that's been made to that nervous system, okay? And so we have adjusted that pelvis area. So the next part of the adjustment is going to be the thoracic adjustment, and we're going to use the drop pieces for this. So again, the drop piece will absorb all the impact. I will adjust the table settings so that only the thoracic area comes up. And what I'm going to do is I'm going to find where I need to adjust. And then once I've found that, the drop piece will absorb the impact as I adjust that area. So now I'm going to show you how I adjust a cervical spine with the drop pieces and stuff. So I'm going to get my patient to turn his head to this direction, okay? He's going to stay in that direction. I'm now going to adjust the drop pieces accordingly. So only the upper thoracic part and the cervical part actually come up. Great. And once we've done that, I then come in, I find where I need to adjust. I pretty much have contact on that area. This hand is just gently on the head, and then I adjust through. So now that you've seen that drop piece technique and you've seen how I adjust the patient, the understanding is that I'm not curing spinal stenosis. I'm not fixing spinal stenosis. That's a condition. You have that. It's permanent. It's part of your nervous system. This is what's occurring. But you have to make things more manageable. And you have to do things in a gentle fashion. You have to do things gradually. One adjustment is not going to cure it. It's not going to fix it, nor is it going to make it completely manageable. But a continual, gradual process of getting adjusted makes a difference with somebody who has spinal stenosis. So I would always recommend seeing a chiropractor with spinal stenosis and stuff and getting adjusted, because it makes a difference. And that's why you should be seeing a chiropractor. You should be making sure your chiropractor knows the drop piece technique and can use the drop piece technique that can help you facilitate getting better. Hopefully you found my video educational today. My name is Dr. Shariff. I'm a local chiropractor in Oshawa, Ontario. My clinic name is Infinite Healing Chiropractic and Wellness Center. And I would encourage you to like this video, subscribe to my channel, because I'm going to keep on showing you more videos on how to maximize and optimize your potential so you can live life to the fullest.